Welcome to the In My Opinion show with your host, Heny Hatter and friends. Seen on the internet 24 hours a day, 7 days a week. To view the show, go to flinttalkradio.com, then access videos and click on In My Opinion. Before we get started this afternoon with the program, I would like to mention October is designated Breast Cancer Awareness Month. Every month should be designated Healthcare Awareness Month. Men and women should get their yearly health exams. Good health is the most important asset you possess. It's not money or other material possessions. Without good health, you have nothing. If you feel sick or have breast abnormalities at any age, make your health care professionals do the test. It is essential that the right test be performed by your doctor. Otherwise, you should see another doctor that will perform the correct test. Your life may depend on it. It's just that simple. And on another note, don't forget to vote. And when you vote, make your vote count. Vote intelligently. Vote for those who have your interest at heart. Don't vote for name recognition, friends or neighbors or elected officials, especially if they've done nothing to enhance the welfare of your communities or the quality of your lives. Now, we have a very special guest this afternoon. He is Richard Haden, a healthcare professional. Richard, would you tell us a little bit about your background?
Sure. Thanks, Henry. I appreciate you guys having me. My background is I am a graduate of University of Michigan Flint with a degree in finance. I spent some time in recruiting for General Motors, first out of college, but primarily I've spent the last 10 years in financial services. Just a little clarification, I ran a research division for a financial planning firm, independent financial advisory firm, and my job basically was a research analyst. I ran the division and the department for them, conducted multiple macroeconomic research, fundamental technical analysis of publicly traded companies, and currently I am a life and health specialist in insurance, and we're going to talk further, of course, about the health co-op that I'm involved in.
Yeah, I know that should be very interesting to this audience, and we should just relax and we'll have fun at just kind of asking questions and trading off so that people benefit from what we are discussing. Now, as there's evidence from empirical data that there's a problem with American healthcare systems, irrespective of whether the users are Second World War babies or baby boomers or X or Y generation, they all seem to have a problem with healthcare. What's your perspective on this problem?
Wow. Well, as we've discussed before, I don't have the end-all conclusion or answer to healthcare. There's obviously a number of issues, I think, right now. One of them is that it just costs too much. It's cost prohibitive. It's a $2.3 trillion industry as far as cost is concerned at this point, and we really need to get it down into the 1 to 1.5 trillion. And how do you do that? That's a great question. There's probably multiple answers, but I mean, really, from a cost perspective, it's not feasible. From a health coverage perspective, Henry, it's just not working right now. You can't pick and choose who you're going to cover based on pre-existing conditions, and that would be a huge. I think that would be one part of the equation to solving the problem, is just erasing pre-existing conditions, and where insurance companies are mandated to accept you no matter what. Problem with that is that will raise premiums, of course, and again, adds to the cost prohibitive side of the equation. So a lot of problems right now that we need to address, and I don't think there is a simple answer, and that's why we're going through what we're going through with the public plan options right now.
Well, first of all, can you kind of give us a kind of a hint as to what's the difference between health care and health insurance?
Well, health insurance, of course, is something that, my opinion of health insurance is that it is a private industry. Okay, it is run by big companies, conglomerates, who are for profit. And that includes, in my opinion, Blue Cross. To be honest with you, even though they're not for profit and they are mandated to accept you, they own the industry. They have 85 million members right now currently in the United States, and that is, I mean, it's a monstrosity. They're huge. So Blue Cross is part of the problem, in my opinion, because they raise costs 20 to 30% every single year, sometimes every 6 months. So health insurance is a privately run for-profit opportunity, but health care could be a whole host of unique things, Henry. And I guess my opinion on this is healthcare is what we're doing now. I'm part of this health co-op of Michigan, with Dr. Bouvier out of Grand Blanc, Michigan. And what we're trying to do is provide health care to individuals, health plans, not health insurance. And to me, health care is taking care of your primary foundational medical issues, so you don't get to the chronic or catastrophic stages in your health where the costs start skyrocketing. And that's part of the problem, obviously, is we're not doing that.
Well, isn't healthcare also defined as government-funded insurance through Medicaid and Medicare?
Yeah,
Government
certainly.
funding insurance. That's
Certainly.
different than healthcare by an employer.
It is, but of course, health care is health insurance is not just Medicare or government funded. It's privately,
Sure.
it's privately owned institutions giving you some type of health coverage, basically absorbing and taking on the risk of your health for a price. And that's the premium that you pay every month. With Medicare and Medicaid, that is government funded. That is what they call a single payer system, and that is a government run institution, government run industry. So what we're trying to do is say we're trying to come in with this health co-op, and it's called My Medcare. What we're trying to do is come in and say, look, for $420 a year, an individual.
Before you get involved
okay.
in
Sorry.
that, let me go back and clarify. I want to be able to partition out the difference between healthcare
Sure.
and insurance. Now, and I'll do that by asking you another question. Do all Americans have health care?
All Americans, they have the choice of health care. See, the problem is that it's not affordable. So, in my opinion, all Americans have a choice of health care. They have a choice of health insurance as well. No matter how you look at it, there's a cost to either one.
Well, do all Americans have health care with respect to Medicaid, Medicare, the government-funded health insurance?
No.
They
No,
don't.
they don't.
They don't.
No, because you have to qualify on an income basis for Medicaid if you're under 65. So if you're under the age of 65, even though Medicaid is available for you, you have to qualify as a low-income individual or family to get it. So it is available to people, but the issue is there could be, real quick, there could be somebody that is just over the edge on the income limit, just over the income limit to be accepted for Medicaid, but yet that doesn't mean that they can afford health insurance. They're stuck. They're a low-income family that's stuck, that cannot qualify for Medicaid but can't afford health insurance, but they want it. So everybody has access to some form of health care. We're trying to redefine what health care is.
Okay, let's say that John Doe is walking down the street adjacent to where this building is, and he steps in a hole and breaks his leg. He has no insurance.
Mm-hmm.
He has only his ID and medical records on him.
Sure.
Would he be treated?
He's going to have to go to the hospital at that point.
Would it be treated? Yeah.
Well, it depends on what hospital you go to. I'm being frank with you. I mean, really, it depends. Hurley, as you know, would treat him if he didn't have insurance, most likely. Genesis and McLaren may not. They may ship them to Hurley if they know that they'll take care of the uninsured. So,
Have you ever had an incident or heard of an incident where a person has gotten sick on the street and never been and refused treatment
yes, I have.
in the United States?
Absolutely.
Was it something that required urgent care?
I've I don't know. I mean, I wasn't there. This is some of the research that I do. In reading that, it all depends on the area you're in and the hospital. Because really that's who you're going to go to. And I'll tell you, part of the problem right now that you're seeing is that you have these ER rooms being utilized as clinics, urgent care clinics, after hours clinics by those types of people where they may not have insurance, but they decide, okay, I'm chronically ill, something happened, I'm going to go to the ER. And what's happening is insurance companies are starting to charge for that.
Well, isn't that health care?
No.
But if you go into the hospital, somebody treats you.
Depending again on where you see, healthcare to me is healthcare, and you and I have discussed this should be accessible to everyone. Everybody should have access to healthcare,
Okay.
and they don't at this point because obviously we do not have a nationalized, socialized system, healthcare system,
Okay,
which I don't want.
Do all people under 21 in the United States have health insurance under Medicaid?
Under Medicaid?
Yes.
That's a great question. Medicaid is not something that's my absolute specialty, but I'm not sure. That's a good question. I can find that out for you. Under the age of 21, I'm not sure.
Yeah, well, please believe me, all kids in the United States under 21, high school age, K through 12 age, have Medicaid.
Okay.
Called Medicaid.
Okay.
It may be It may be a variety of packages under Medicaid, but all kids are taken care of in the United States,
Okay.
no matter where they live and what their circumstances are.
See, that's not my experience, though.
Okay.
And I don't think people know that.
Yes.
To be honest with
and,
you.
and a lot of the audience out there don't know that either.
So yeah, I mean,
If
and
you
again,
take if your child is coughing up.
no, I understand. I got that.
Yeah.
Where I guess my point is where are you going with the point? What do you want to derive from that?
Well, what I was wondering is whether, indeed, all of the generations of people do see that American healthcare system have real problem.
Yeah, I mean, I think most people do. I just think it's a lack of knowledge and education on what exactly our healthcare system is. I don't think people really know what the problems are. They just hear the media, and whatever the media, the hype is in the media, and the level of the hype at certain time in history, that's exactly, you're going to get more of a response from the masses, depending on where the media stands on the coverage. And it's a hot topic, hot issue right now. 5 years ago, even, I mean, so in Clinton's administration, he tried to pass nationalized health care. It was not an issue. The media was not covering it. It was not as big as it is now with Obama. So you had Clinton versus Obama, both pushing health care, but today it is a much more serious topic, and it's a much hotter topic in the media than it was back in the 90s. And that's why you have a response from the masses right now. That they don't understand what's going on, and the more information that's thrown at them, the more confused they get.
As Americans, should all Americans be entitled to health care? Maybe that's the right question.
Well,
Dan.
sure. I believe that's like I said. Health care, yes, absolutely. And nobody should be denied because they have asthma or sleep apnea. But with insurance companies, that is the case. People are that on a consistent basis being denied.
And that part of the issue that leads us into the healthcare debate, because there are other segments of the society seeing that some people don't have access to healthcare, and that helps to drive the debate, right?
Yeah. Yes. Absolutely. I mean, you have. Unfortunately, I don't want to get too into it, but you have an issue with class gaps in education levels of individuals and classes and sections of the economy. And so, there are certain people that could care less, obviously, about health insurance right now. They're just trying to make their ends meet, and they don't need health insurance. They probably need it. They don't want it. There are loads of people out there that do not want health insurance or health coverage. And I think part of the problem with that is that and they're not involved in this debate, Henry, so they're not looking for it. They don't want to be involved in it. And then, of course, you have the individuals that have a little bit of knowledge and they're throwing their 2 cents in. And then you have the other crowd that I think is educated on the subject, and that's where much of the debate is happening right now, I think, is in that crowd.
So much of the confusion in the debate is because the people who are really talking about healthcare and that we hear most are the people who have spends on either side, extreme sides. You're either for a healthcare system that serves all Americans,
Right.
or you are not against it. You're for the individual system that serve those who can best fit into the system. But what people want is to be able to decide what's in the system for them. How do they make that system work for them? And I understand that you bring a completely different perspective to the healthcare debate that bridges the gap between those who have health insurance and those who have seemingly health care. I have to put it that way.
Right.
You want to explain what are you doing as a business individual and a healthcare professional to add some kind of relief to those people who would like to have healthcare insurance but can't get it because they don't either have the money or they don't qualify for the existing system?
Well, right now this is a strong passion of mine. I mean, I am partnered with a doctor out of Grand Blanc, and we have basically created a health co-op. And this co-op, the model that this is structured by is basically we will give and provide primary foundational medical care, okay, for all individuals, families, and even employers, okay, with their employees. For a nominal fee every single month. So, for instance, an individual can come into the health co-op, the doctor's office, and they can get their primary medical care, which includes, of course, office visits, consultations, physicals, preventive and wellness care, illness and injury. They can get prescriptions written and have all of their chronic care issues maintained. We have a chronic disease management program as well that includes hypertension, which is blood pressure, diabetes and blood sugar management, cholesterol, pulmonary lung diseases, heart attack and stroke prevention, arthritis, kidney function, and asthma. And these are the primary list. But all of this care can be managed and taken care of for an individual for $35 a month. And this is if you want to become a member in what's called My Medcare, which is within the health co-op, for an individual it's $35 a month, which is $420 per year. I mean, normally an individual would pay $300 to $400 a month for their coverage. So what we're doing is, and for a family, by the way, Henry, it's $950 a year. And if you have 4 or 5 kids, it doesn't matter. So what we're trying to do is we're bringing, everybody's asked for healthcare reform, okay, without government intervention. Well, we're giving that to them, I believe. And this model is a way to provide healthcare, take care of all your primary foundational medical needs, which, is 70 to 80% of your healthcare. Because the other piece of the pie that we don't cover through this health co-op is your catastrophic hospitalization. So if something big happens and you have to go to the hospital, obviously that's not Doc's responsibility. You're going to have to go to a hospital. He's a general practitioner and internist for 23 years now. So he's been in his practice for 2 decades now. And so what we're doing is we're offering all the primary, which is the bulk of your medical care, for a nominal fee. I mean, if you think about it, it's quite phenomenal what we're doing. And my passion right now is devoted, and my commitment and my energy is devoted to this model and this service to Genesee County right now.
And basically, this is a kind of a preventative, based on prevention.
It's based on prevention, but also if you do have a chronic illness such as asthma,
sure,
you can come in and he'll create a program for you to manage that.
But there isn't primary care the area that most of the young people would be engaged in, not urgent care.
Absolutely, yeah.
And they have less severe health problems, right?
Mm-hmm.
And therefore, you can look at the realization that what you are saying is reasonable because this is your low risk areas, right?
I would say that it's a low risk area. Yes, I mean
Low
the
risk
younger
area
adults
for,
are low risk, but just keep in mind there are 133 million people in the United States that have a chronic illness.
sure,
That's a third of the population.
pre-existing condition.
A pre-existing chronic illness such as heart
Yeah.
problems, stroke,
Sure.
asthma, which is highly prevalent in young adults right now.
Now, looking at that from after you partition primary care from urgent care, where you have to be hospitalized, that does appear to be reasonable for an individual to engage in when that person is basically dealing with primary health care issues, either for children or for himself or
Absolutely.
herself.
Sure.
And if a person, this also rolls in urgency to do exercise and to keep the body up and drink water and maintain good health so that your problems are stable in the primary health care arena or function.
The less you take care of
Yeah.
yourself, of course, the higher the cost of your medical care. That is a proven stat. I mean, if you do not take care of yourself with decent diet and exercise, and with going in and getting your physicals, which this includes, get your annual physicals and get all your screenings and your checkups, then your cost of your medical care is going to go up over time. No question about
So
that.
for $950 a year, a family can have this kind of health care.
Absolutely.
Family of four, how many?
Family of 5, family of 6.
Okay.
I mean, if you
Is
have
there a
7,
limit?
the doctor himself has 7 kids.
And how many? And how
So-
many per individual? How much?
$420 a year. So $35 a month.
$35 a month or 400.
So obviously, if you have a family,
Sure.
the numbers
Incidentally.
work out. It's
Yeah.
going to be a lot less costly for you as a family than it is an individual.
And the incident rate is going to be lower, isn't it? If you stretch it out over a family.
Sure, incident
Yeah,
meaning
Meaning that
hospitalizations
the occurrence in which you make trips to the doctor.
Oh, sure,
Yeah, it
yeah.
will stretch out over that. So it really pays there. So,
Now, and if I can mention really quick, that is, and Henry, really quickly, that is my Medcare. That is the program I just mentioned. The health co-op that surrounds my Medcare. So if it is another story. The health co-op is a network of specialists, a network of medical professionals that we have built and we have brought into the health co-op. So basically, if you came in and you were having chest pains, okay, and the doc his initial consult, of course, he's going to take a look at you. Your initial consult's going to be taken care of, and if he recommends that you need to be seen and taken care of for an EKG or go to a cardiologist, we have a relationship with a cardiologist. And within this health co-op network, whether it's cardiology, cardiology, endocrinology, urologist, hematology, hospital, Genesis, health screening, clinical labs, physical therapy, MRIs and CAT scans, home health, sleep studies, okay, mental nervous system. This health co-op, these people are all within this co-op, in this network, and they have agreed to special deep discounts, pricing
great
for this.
specialization within the healthcare, right?
Absolutely.
Now, I want to tell me, Richard, what should people learn after hearing you today? What should they be able to do? What kind of lessons can they take back within their own domain and work on better health care for their future?
Well, the first thing I would suggest is, and for time purposes, let me give my contact information. My name again is Richard Haden. You can reach me at 810-644-2140. That is my office number. So if you have any further questions or just need information, just please give me a call. And in regards to what they can take away from this, I think that
What should they learn? Because they're learning nothing from the national picture.
No,
right?
and
Okay.
speaking to everybody out there right now, you're not going to learn everything in our 25, 27-minute conversation here. But what you should realize is that the healthcare system, the way it is structured, is not working, is not going to work. and it's going to get more and more expensive, no matter if it stays private or if the government institutes a public plan. No matter what avenue you go down that way, those two avenues are going to still lead to higher prices. So just realize that it's not going to matter from a price standpoint, according to your pocketbooks, which direction we go in. It's still going higher.
But
So
we want to
this
focus
is-
only
it's-
on what you offer.
I understand, and this model is brand new. Nobody else is doing this. Okay, no one else that I know of is doing this, and it's taken us a year to get these relationships built. So this is healthcare reform without government intervention. Takes insurance out of the picture and allows families really to afford primary foundational health care. And I think this is the way the future, and hopefully you can sense it because I'm pretty passionate about this. I think this is where it's going. This is the direction that healthcare should be going in, and I think we've done a great thing and the right thing in this community.
And I'm
So-
gonna ask our audience to take a closer look at primary health care. Help define what it is, how it affects you, what your options are, how it can improve the quality of life for you, and as opposed to urgent care. And what Richard has done an excellent job in giving you a new venue, a new spin to how you should approach the future with your health care until the model that's before Congress now is resolved. Richard, anything else?
Not really, Henry, at this point. Again, just if there's any questions or if you're interested in signing on as a member of the Health Co-op, please contact me at 810-644-2140.
Thank you, Richard. I
welcome.
appreciate that. Now, at this time, we must bring the In My Opinion show to a close. But first, I want to thank our guest, Richard Haden, and another special guest, Dr. Bouvier, who is not present today, but who may be present in the future, and one of our guests at that time. Until next time, stay